Hello everyone, my name is Rizida and welcome to our lesson. Today we're going to speak about surgery and operating room vocabulary. In this lesson we will learn words related to staff, we will learn words related to equipment, procedures and environment in the operating room. Всем здравствуйте, меня зовут Rizida, и сегодня мы с вами поговорим об операции, об операционной комнате, выучим слова, связанные с персоналом, людьми, которые находятся в операционной комнате, поговорим об оборудовании, различных процедурах и вообще о среде в операционной. So, let's begin. So the first one is surgeon. Surgeon – это хирург. Anesthesiologist. Anesthesiologist. Once again, it's a difficult word. Anesthesiologist. Это анестезиолог. Scrub nurse. Once again, scrub nurse. Это операционная медсестра. Circulating nurse. Circulating nurse. Это дежурная медсестра. Surgical assistant. Surgical assistant. Это ассистент хирурга. Radiology technician. Radiology technician. Это рентгенолог. Perfusionist. Perfusionist. Это перфузиолог. Resident. Resident. Это резидент либо ординатор. And medical student. Medical student. Это студент-медик. So, you can pause the video once again. You can read the words, read its transcription, definition of each term, and we have translation in Russian. Let's go on. Let's have a look at the equipment. Scalpel. So, scalpel. Это скальпель. Forceps. Forceps. Это щипцы. Searcher. Searcher. Это шов. Retractor. Retractor. Это расширитель. Electrocautery. Electrocautery. Это электрокоагулятор. Endoscope. Endoscope. Это эндоскоп. Suction machine. Suction machine. Это аппарат для отсасывания жидкости. Surgical scissors. Surgical scissors. Хирургические ножницы. And the last one, drapes. Drapes. Это хирургические простыни. Now let's talk about procedures. Сейчас давайте поговорим о процедурах. Incision. Incision. Incision – это разрез. Excision. Excision. Это иссечение. Laparoscopy. Laparoscopy. Это лапароскопия. Hemostasis. Hemostasis. Это гемостаз. Anastomosis. Anastomosis. Это анастомоз. Biopsy. Biopsy. Биопсия. Decompression. Decompression. Это декомпрессия. And the last word, resection. Resection. Резекция. Now let's have a look at the words related to environment and equipment in operating room. Operating room – это операционная. Sterile field. Sterile field. Это стерильное поле. Scrub area. Scrub area. Это зона для мытья рук. Anesthesia machine. Anesthesia machine. Это аппарат для анестезии. Monitor. Monitor. Монитор. Sterilizer. Sterilizer. Это стерилизатор. Lighting system. lighting system – это хирургическое освещение. And prep area, либо полностью preparation area. Again, prep area or preparation area – это зона подготовки пациента. So now we have come to the exercises. We have to match the words in column A with their definitions in column B. You can pause the video, go back to the first slides, revise the new words, and then do the exercise. Pause the video and later we will check the correct answers. So now let's check the correct answers. Surgeon, that is E, a specialist in performing surgical procedures. Surgeon – это хирург. The second one, anesthesiologist. Anesthesiologist, that is A, a doctor responsible for administrating anesthesia. Anesthesiologist – это анестезиолог. Scrub nurse. Scrub nurse, that is C, a nurse managing sterile instruments and assisting the surgeon. So scrub nurse – это операционная медсестра. Circulating nurse, that is F, a nurse managing supplies and maintaining sterile conditions. Circulating nurse – это дежурная медсестра. Perfusionist. Perfusionist, that is B, a professional who operates the heart-lung machine during surgery. Perfusionist – это перфузиолог. And the last one is resident. Resident, that is D, a doctor in training who assists in surgeries under supervision. Resident – это ординатор, либо резидент. Now let's have a look at exercise 2. You have to fill in the blanks. You have to complete 5 sentences with the correct words from the box. We have surgeon, we have anesthesiologist, scrub nurse, perfusionist, resident, and radiology technician. So pause the video, read the sentences, and complete the blanks with the appropriate word. Now let's have a look at the correct answers. The first one, the anesthesiologist ensures the patient receives the right amount of anesthesia during the operation. The second one, the radiology technician operates the imaging devices to assist the surgical team. The scrub nurse is responsible for handing sterile instruments to the surgeon. The perfusionist operates the heart-lung machine during cardiac surgeries. And the last one, during training, a resident learns to assist in complex surgeries. And in exercise 3, you have to decide whether the sentences are true or false. Pause the video, read the sentences, and decide if they are true or if they are false. Now let's check the correct answers. The first one is false. A perfusionist is responsible for handling sterile instruments. No, a perfusionist operates the heart-lung machine, so that's why it is false. The second one, a circulating nurse does not scrub in but manages the operating room environment. That is true. An anesthesiologist monitors the patient's vital signs during surgery. That is true. And the last one, a resident is a fully licensed surgeon. That is false. They are still in training. So, as a homework, you have to work in pairs and you have to assign each a role. One of you will be a surgeon, one of you will be a scrub nurse, anesthesiologist. You have to create a dialogue in which you collaborate during a surgical procedure using the relevant vocabulary. For example, if you're a surgeon, you have to say, scrub nurse, pass me the scalpel, here you go, doctor. and anesthesiologist says patient's vitals are stable, ready to proceed. So you have to use the vocabulary you have learned today. So this is the end of our today's lesson. Hope that you have learned a lot of new things. See you next time. Goodbye.